Dr. Nyberg, when you get a report for a non-invasive prenatal test, what does that show?
When you get a result back for the NIPT test, of course it's usually normal. Important thing to remember is that it's normal for the chromosomes that were tested for. So if you choose the Harmony test, if a patient chooses the Harmony test, it's normal for trisomy 21, 18, and 13. That is a very low risk of those chromosome abnormalities. It doesn't mean that all the chromosomes are normal because it didn't test for all the chromosomes. Now, the results can come back in two different ways. The Harmony test, for example, will come back with a very low risk of 1 in 10,000, and sometimes that confuses patients. That's the lab's way of saying is normal. It's as low as risk as they can get, but they don't want to say, it's like saying it's not 100%, but they use that for all patients, 1 in 10,000. Other labs like Sequenom or the Maternity 21 will come back with a positive or negative report. But again, most times we're going to get a normal report, and we're very happy to tell patients that it's normal. But it's important to recognize it's normal for the chromosomes that it was tested for. Right. If it's positive, then we would need to confirm that. Fortunately, that doesn't happen very often. Certainly, if it's positive, there's a much higher risk of a chromosome abnormality. And usually we'll know that also in combination with our ultrasound. But anyway, we can discuss that with the patient if that were to occur, but it does not mean 100% that it's an affected baby.
So if you get a positive report for a patient, what happens next? Where do they go from there?
Well, it's individual. If we get a positive result, obviously I'm going to discuss it with the patient, and we're going to correlate that with any ultrasound that we might have done here. If it really does have if there really is an affected baby, usually we will have clues from the ultrasound. But then we'll give them the option or recommend that they have other kinds of testing to confirm that, and that's available, and we'll get the patients to the right resource.
And further testing would be the more invasive type of testing by CVS or amnio, is that correct?
That's correct. And that's a good question, because you could do either test, but because the NIPT test is actually very similar to a chorionic villus sampling, that is, the cells that we test for really seem to come from the placenta. That's true of this CVS as well. We actually would recommend the patient wait and have an amniocentesis if they have a positive NIPT test. An amniocentesis isn't performed until after about 15 weeks. So if they did have a positive result, and again that's uncommon, we would ask for confirmation with an amniocentesis after 15 weeks.
And if you get a negative report, does it mean that everything is fine?
Again, if you get a normal result, it's normal or very likely to be normal. We can have a high confidence it is normal for the chromosomes that were tested, but not for chromosomes it didn't test for, and also not for what I'd call structural defects. For example, some patients are under the misconception that if it's normal, it means the baby's entirely normal. Again, it's normal for the chromosomes, but conditions like heart defects usually have normal chromosomes, and they're actually more common than some of the chromosome abnormalities, or many of them. So that would not be picked up by the NIPT test. We would need ultrasound to do that, which is why it's just an example why the blood test and ultrasound work so well together. The blood tests are very helpful, but the ultrasound is also extremely helpful.
So the blood test is not the whole picture, it's part of the picture.
It's part of the picture, that's right. It's just like if you had a test, for example, for diabetes during the pregnancy, it would show you don't have diabetes, but it doesn't show you don't have hypertension or something like that. It only tells you what it tested for.
Okay. Dr. Nyberg, thank you very much.
Thank you.